Hi, my name is Dr. Campbell from Onward Behavioral Health, here today to talk to you about post-traumatic stress disorder. Post-traumatic stress disorder, or PTSD, is often talked about in movie and films, television. Typically, it's centered around a character who goes away to war, returns home, and has difficulty acclimating to life at home for many reasons. Maybe they're remembering bad things they did, or they just can't adjust to, just a regular mundane life at home as compared to life in the battlefield. It can also happen to us in our everyday life. A common example is perhaps you get in a really bad car accident, or maybe you were injured or someone else was really injured seriously in that car accident, and which leads you to kind of having crushing anxiety around driving your car, operating a vehicle, being in a vehicle, or anything like that. Now, when you have post-traumatic stress disorder, these symptoms typically last for about 6 months or more. So you could have had an event happen when you were a kid, or an event that happened 6 months ago. It could be just as prevalent today as it was 6 months or many years ago, right? So when you have post-traumatic stress disorder, PTSD, you seek to avoid the things centering around the trauma. So if you were in a really bad car accident, you avoid cars. You don't drive in cars, you're not a passenger in cars, you seek out public transportation. Or if you do, drive in a car, you just feel anxiety the whole time. It's really uncomfortable. You're driving below the speed limit, and it's just really difficult, right? So you're constantly trying to avoid that thing, and you constantly feel threatened, right? So even when you get into a car or around the car, you feel as though something bad's going to happen. You get like this really bad feeling because you've had that experience in the past where something really bad's happened. So you constantly are feeling threatened and uncomfortable related to this event that happened 6 months ago or many years ago. And then you also, on top of like this constant feeling of threat, you're re-experiencing this event, which kind of cements this event in your mind. So you may have flashbacks during the day where you feel as though it's happening all over again. You could have nightmares at night when you least expect it, wake up in cold sweats, just again going through the car accident, even though it happened many months ago, many years ago, and you feel like it just happened all over again. There's help. If you're having any of these symptoms, there's help. You can get talk therapy, medication perhaps can help, but the thing that you really need to do is address it head on. The more we try to avoid these feelings and symptoms, perhaps self-medicate with something like alcohol, typically makes things worse and not better. So if you're having any of these symptoms, please contact your mental health provider and seek help. Thanks.